I want to talk to you a little bit today about the health-centered practice model. And I put a slide up right below the video here in a presentation that I did in 2009, and we were talking about the various niches. You know, I've got like 12 or 15 different niches in dentistry, and this had to do with the perio. And last semester, when I really got into the business of dental hygiene and I showed the program, the soft tissue management program in my practice, where we used the video phase microscope, we did bacterial screening on all new patients, both for strep and for periodontal pathogens, and the whole concept of soft tissue management as a department. And I kind of went into detail with it. And I've been looking all over the internet now for 2 or 3 years for someone or some organization to really kind of bring this all together. And I think it's happening right now. And I found this organization this summer, the AAOSH, the American Academy of Oral Systemic Health. And it was founded by the son of the dentist that started the American Academy of Cosmetic Dentistry, which Dr. Kaufman is a part of. So we know that this is a very, very high quality organization run by very smart people. Okay, he's modeling the work that his father did, and the AACD is the premier, one of the premier organizations in our country. So, and some of the early moves that they're doing is they're getting associated with the Cleveland Clinic and really doing smart things. Okay, so basically this connection of the oral systemic health thing, which we all know about, now this thing is they're getting their arms around it. But something that I ran across this month, which just absolutely blew me away, because this fits very, very much into Obamacare. Everything is kind of coalescing at one point in time. And here are 3 studies that were done in 2012 by Aetna, Concordia Insurance, and there was one other one which escapes me. But anyway, they want to know the cost savings of patients with diabetes and heart disease and all these things who are undergoing periodontal maintenance. And so this particular study was on diabetic care. There was a 61% reduction in hospital admissions, 41% reduction in physician visits, 32% reduction in medical cost for a diabetic patient under periodontal maintenance. Okay, now this kind of thing has never been done before, where they've actually looked at cost savings. So you take this and extrapolate it over all of our healthcare cost issues. Now this concept that I talked about in 2009, where I said the biological health-oriented practice is the largest emergent market, the largest emerging market in history. There it is. It's right there. To be able to go in and reduce healthcare costs 10, 20, and 30%. This article talks about the costs of cardiovascular disease in our country is $444 billion with a B annually. So if you were to cut 10% off of that cost, that would be $40 billion. I mean, these are gigantic numbers. But the knowledge is there, and now it's being coalesced, and this organization, the AAOSH, is bringing like-minded people together. I plan on joining this. I plan on going to their fall meeting, and I want to know more about this, because when we talk about creating a model for the future, there is no question there is an opportunity. You know, we've talked about it in class. Dr. Kaufman and I have kind of, we're trying to create this model. This is the model. Okay, this is not drill and fill, skies falling PPO. This is really understanding your role, the medical model of dentistry, and treating disease, and really being a contributor to the healthcare system. So watch this video down below, and you're going to hear me talk a lot about this in the coming months.